गजाननं भूतगणादिसेवितं कपित्तजम्बूफलसारभक्षितम् उमासुतं शोकविनाशकारणं नमामि विघ्नेश्वरपादपङ्कजम् अगजानन पद्मार्कं गजाननमहर्निशम् अनेकदन्तं भक्तानाम् एकदन्तम् उपास्महे. Now, let us start today's program. Knowledge makes a man unfit to be a slave. It is a famous quote of Frederick Douglass, an American social reformer. A very good morning to all. Today, Nitte deemed to be university is celebrating World Human Rights Day. This program is organized by the Department of Humanities in collaboration with Electoral Literacy Club Nitte deemed to be university. Before starting the program, I wish to give a small note on Human Rights Day. Human Rights Day is celebrated annually across the world on 10th December every year. The General Assembly of the United Nations adopted and proclaimed the Universal Declaration of Human Rights on 10th December 1948. This day was established for the protection and promotion of human rights, which works on rights relating to life, liberty, equality, and dignity of an individual. More than 30 rights and freedom belongs to us all. According to the United Nations official site, the Universal Declaration of Human Rights is a milestone document in the history of human rights. Drafted by representatives with different legal and cultural backgrounds from all regions of the world. The declaration was proclaimed by the United Nations General Assembly in Paris on 10th December 1948. This year, Human Rights Day theme is related to the COVID-19 pandemic and focuses on the need to build back better by ensuring human rights are central to recovery efforts. One will reach his or her common global goals only if one can create equal opportunities for all, addresses the failures exposed and exploited by COVID-19, and apply human rights standards to tackle deep-rooted, systematic, and intergenerational inequalities, exclusion, and discrimination. National Human Rights Commission of India was established on 12th October 1993. It was established for the protection and promotion of human rights, which works on rights relating to life, liberty, equality, and dignity of an individual. It reminds us that every human is important and are entitled to the rights regardless of caste, creed, religion, race, color, language, and sex. Thank you. As you all aware about the program, Professor Dr. Satish Kumar Bandari, the Honorable Vice Chancellor of Nitte deemed to be University, will be giving the opening remarks, and Dr. Amashi A. Shetty, Professor and Associate Dean of Student Welfare of A.B. Shetty Dental Institute. I, okay, sorry. and she will give as a resource person, and she will present a talk on the theme. For the great occasion, I heartily welcome Professor Dr. Satish Kumar Bandari, Honorable Vice Chancellor.
You're muted. You're muted, Suma.
ಸುಮಾ ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಮಾತಾಡಿ. ಸುಮಾ
Can we? Hello, Sumani ಕೇಳ್ತದ Suma?
On behalf of the Department of Humanities, over to you, sir.
Very good morning. It's my privilege to be part of this World Human Rights Day. I congratulate the Department of Humanities for organizing this very important day, World Human Rights Day. My colleagues from Nita University and the resource person, Dr. Amarashri, professor of, from the Department of Pediatric and Preventive Dentistry,
Yes.
and the faculty from the Humanities Department, faculty, the Director of Faculty Development. Hello? Can I proceed? First of all, I should congratulate the department for organizing this very important day. And now the job has been made easy by the moderator, Mrs. Suma. She has given a brief account of what is World Human Rights Day. The why we are celebrating this day, we should understand, because our aim is to create awareness about human rights, because the human rights is very important part of anybody's life. We have to live with the dignity, human dignity. And if you go to the history of this day, as Suma said, we started celebrating World Human Rights Day way back from 1948. That was the Universal Declaration of Human Rights by United Nations General Assembly.
Yes, sir.
Hello, who is interfering? Okay. So that is very important declaration by the the United Nations.
Sir.
As you know, it was translated to more than 500 languages, I understand. And it is created Guinness Book record, because one of the most translated documents, the history of mankind. So we should be aware that this United Nations declaration is celebrated on the 10th of December as the Human Rights Day. That we are going through unprecedented crisis caused by the pandemic, COVID-19, and the people who have been affected are mainly the children and women. And the effect is enormous, and the particular underprivileged people who have been affected by this, and it will take years to get them to recover. And it has caused, it has widened the gap between the rich and the poor, and the inequality and discrimination have deepened because of the COVID pandemic. As the scientists suggest, this is not going to end immediately. It may continue till 2022 or even up to 24. I think the people may have to follow the strict guidelines like wearing mask, social distancing, personal hygiene. All these things may have to be continued. And particularly the marginalized people will be finding difficult to meet the requirements. And definitely it is going to affect the mankind. And I am very doubtful that whether we are going to return back to the pre-COVID conditions immediately. So then definitely the sufferers will be the underprivileged people. So we have to, I think, address this issue jointly. Not only the people, not only the government, you have to join with the NGOs and the organizations, institutions, and the university has got a larger role to play in creating awareness about the World Human Rights Day and the rights of the people. As Suma said, the Universal Declaration has given more than 30 rights. All these rights comes with a little responsibility also. We should be aware of the responsibility. Nobody can misuse their rights. If you misuse the rights, the underprivileged will be affected by this. So we have to know our responsibility also. So let us all work in creating awareness about the human rights, the dignity, the fairness, which should be applicable to everybody, irrespective of the caste, creed, color, and let us work towards creating an environment of justice. With this, as Suma said, the theme is building awareness towards the COVID safe lifestyle, and the sub theme is recover better, stand up for human rights. As you all know, our university with this, its 1,000-bed hospital and peripheral centers has done a great job during this pandemic, and we have addressed the issue of not only treating the patient, creating awareness. And Dr. Amarashri Shetty, professor of preventive dentistry, has done a wonderful job, and she has done a lot of work in creating awareness about COVID-19. And she has done the training of teachers training for more than 1,500 teachers have been trained. It's appropriate that she is going to address during this webinar about the building awareness towards COVID safe lifestyle. I hope this celebration very fruitful, and the university will be able to send the message of universal brotherhood and human dignity and fairness to all the participants in this webinar. Wish you all the best. May God bless you. Over to the moderator.
Thank you very much, sir, for your golden words. Now I request our resource person, Dr. Amarashri Shetty, to present related. Over to you.
Thank you so much, Suma. First and foremost, thank you. I thank the Department of Humanities and the Literary, which is working in collaboration with the Literary Club, for having given me this opportunity to have this webinar on this day, that is 10th of December, which is supposed to be the Human Rights Day. And thank you, sir, Honorable Vice Chancellor, for your very kind words and on my introduction. I think not wanting to waste too much of time, I think I should be starting my webinar. And just a moment. Good morning, everybody. And today's theme is Do It Right and Stay COVID Safe, which is building awareness towards a COVID safe lifestyle. As I said, I thank this opportunity for having, getting an opportunity to present on the Human Rights Day. I have put a logo of NSPEC because NSPEC is Niti Special Childcare Center, and which took the initiative of creating an awareness amongst the teachers, and our purpose was to reach the special children. So I do want to still carry that logo around when I'm making my talks. Now coming to the first slide, as Sir said, the human rights per se has about 30 articles, more than 30 articles. Amongst them, this was given by the Universal Declaration of Human Rights, United Nations General Assembly in Paris. That was in 1948. And let me just concentrate on the first article. What they said was all human beings are born free and equal in dignity and rights. When we say equal in dignity and rights, we're talking about how do I apply this to what I'm talking today. When I say rights, I think working in a health sector or in an organization that we are in, I think it is our right to be safe during a pandemic like COVID. It is necessary for us to take care of the patients who come to us, or of the people who approach this institute. But at the same time, as you take care of them, the patients, I think it is only right that you take care of yourself also, because if you're not fine, then I do not think you're in a position to take care of anybody else. So sometimes you need to put yourself ahead of the rest so that it is good for the rest as well as yourself. So that is why I believe that this particular article is very apt for what I'm speaking today. Again, human rights should be the center of post-COVID world today, and this year's theme by the human rights is recover better, stand up for human rights. When we say recover better, the message is fantastic, where they're trying to say that you have to recover better post-COVID, because COVID situation, as Ms. Suma said, or Dr. Satish Bhandari, our Honorable Vice Chancellor, said, it has handicapped most of us. This situation has exploited a lot of situations. But at the same time, let's look at the brighter side. It is giving us an opportunity to make this world a little better, probably restart, rejuvenate ourselves and restart all over. So what did the Human Rights Department highlight on this year? They said, they have spoken about 4 points when they brought up this theme called Recover Better. End of discrimination of any kind, address inequalities, encourage participation and solidarity, and finally, promote sustainable development. Now, when they said end discrimination of any kind, they spoke about structural discrimination and racism. I think being in India, we're not talking about racism or structural discrimination. We are talking about everybody, irrespective of the class, irrespective of the cadre, or irrespective of the economic background they belong to. I think nobody should get discriminated when it comes to their right to attain a very good healthcare. The next thing is addressing inequalities. To recover from this crisis, we have to address that point called inequality. Yes, we know that staying in a country, there are people belonging to different cadres or different economic backgrounds. So definitely there is a situation of inequality, but we need to promote and protect the economic, social, and cultural rights of every person, who is going to come for their rights into healthcare. Next is encourage participation and solidarity. See, in a situation as COVID, when everybody is, tied up, or should I say, is taking a back step, we have to understand that it is not one person's responsibility. There's no point blaming a hospital. There is no point blaming a government. There's no point blaming any other situation. You have to take responsibility. You have to take charge of this current situation, and you have to, participate. And when there is a rule that is put forth, so which is for the betterment of the entire world per se, or the entire human race, I think it is your responsibility to actually accept it and then do your level best to follow all those rules and regulations and work in solidarity so that the situation is overcome. Finally, it is promoting sustainable development. I think at the end of it, the whole purpose of human rights, or the whole purpose of this entire process by the humanitarian section is only to intervene and promote a sustainable environment for people as well as this planet. So finally, coming to the first point, COVID education. Now, COVID education falls into the same right. Now, why COVID education? See, when I said that every person has a right to information, the person giving out the information should also be aware, and they should also be aware of their own rights at the same time. So the COVID education is done so that the citizens be provided with the right information on COVID-19 so that you can prevent potential spread. You can educate patients, your caregivers, your guardians, or the parents, with age appropriate information. Whoever comes to you, you need to educate them. Now, I do not think that nobody knows what COVID-19 is, but when you start a particular webinar, I believe in giving a small gist of it. So what is COVID-19? COVID-19 is a disease, is a new strain of coronavirus. So co means corona, V means virus, D stands for disease. And it was formerly known as novel coronavirus. And why 2019? Because that is the year the outbreak happened. So presently it is called as COVID-19. Now, simple facts about COVID-19. See, 90% of the people are are positive, but asymptomatic. It is a fantastic thing that they are asymptomatic, but what we need to understand is it is good for them, but they can be dangerous for the rest of the world. So we need to, as I said previously, when the human rights spoke about solidarity, you have to, and cooperation, you have to understand that the current situation is such that you should be behaving in such a way that you do not become a person who spreads this particular virus. So that is why you have to understand that with 90% people being asymptomatic, you have to understand the seriousness of the condition. At the same time, the good point is 9%, only 9% of them have minimum symptoms where it does not require admission, and 0.5% require admission but only for monitoring purpose. But ultimately it comes to that last lot, less than 0.1%, 0.1%, where they go into a serious situation. And who are they? They are probably immunocompromised patients, people with with the pre-existing medical conditions, people who are diabetic, etc. So, and also, I would also like to include or remind that there is also one more category, that is children with special healthcare needs. That is one sector which is not going to sustain this particular COVID environment. So let's keep them also in our minds. Now, how does COVID transmission happen? Mainly sneezing, droplet virus, when you talk, and due to direct contact or indirect contact. Now, when I say probably, if you're probably using a doorknob to enter a room, and another person who is probably COVID positive, which we are not aware of, has also touched the same knob, it's not like you touch a knob and you get COVID-19. It's just that after having touched the knob, make sure that you do not touch your eyes, ears, and in eyes, nose, and mouth. So that is how you prevent the potential spread. Now, what are the symptoms of COVID-19? One is fever, cough, sore throat, fatigue, shortness of breath, usiratada tundare, that is what we say, and loose stools. Presently, it is sudden loss of smell or taste. You have headache and joint pain too. But actually, if you compare the symptoms of COVID-19 to that of a viral fever, I think it more or less looks the same. But what I have gotten to know through through some of the medical sections is when it is a sudden loss of smell, they do feel that it is definitely COVID-19. Now, in case you have these symptoms and you are suspected of it, instead of panicking because of the situation, I think what you need to do is you need to thoroughly clean your hands with soap and water at home, and you have to stay at home. Do not attend work. That is not only to take care of yourself, but also for so that you keep the concern of the general public in mind. Rest and drink plenty of fluids and eat very nutritious food and take care of yourself. Stay in separate rooms so that from your family members, so that they do not get infected because of you. But if it is not possible, at least wear a medical mask and keep a distance of at least 1 meter or at least 3 feet. See, ideally they say the distance that you're supposed to maintain is 6 feet. But for practical purpose, because the infrastructure that we have or the rooms that we have is such that I do not think we can create a 6 feet distance. So ideally, at least maintain 3 feet from other people. Keep the room very well ventilated all the time, and possibly use a dedicated bathroom for yourself. And especially when you're coughing and sneezing, what are the precautions that you need to follow? Now, coming to the basic rules that we need to follow in COVID situations is very simple. Touch-free thermal sensors, if that is when you're going to an institute, where if you're in working in any place, or if you're going to another mall or any other public place, uh, please make sure that the place has touch-free thermal sensors. Make hand washing mandatory for yourself. If not hand washing with sanitizer, at least make use of soap water. If not, if you're a frequent washer of hands, then I suggest you at least use water. Then promote social distancing. I do understand that the incidence of COVID is probably, which is good news, is coming down a bit, but that does not give us, that should not give us an opportunity to go back to our old habits, at least until it completely settles down. So I do believe that we still have to maintain social distancing and teach people the correct way to cough and sneeze. The basic etiquette as of now is to sneeze into your elbow, as I have seen shown in this picture. Because if you're going to sneeze into your hands, then it's a possibility that if you are a carrier of virus, then you might be infecting so many other places. So instead, always cough into your elbow and always make use of a mouth mask. It is not about only your safety, but other people's too. So these are the basic general rules to follow, and I think we are sorted as far as COVID is concerned. And hand washing, minimum of 20 seconds is what we need to maintain with alcohol-free, with alcohol-based sanitizer. And coming to masks, that is the second category. You know how we are going to counter COVID situation. Mask, as I said, is mandatory, at least in public places. The few things that you have to bear in mind is do not exchange mask. That's one thing. When you are in a health sector, or probably in a place where you're looking into too many patients, I think you should be wearing your N95s. Otherwise, you can substitute it with a cloth mask, which is quite breathable. And a face shield is not. Remember, a lot of people wear a face shield and move around in a health sector. Face shield is not a substitute to mask. You can wear it only until and only, when probably you are not in a condition to wear a mask. Face shield is something we normally advise to the category of children with special needs, because most of the time they resist a mask because they are uncooperative, and they do not cooperate when you try to make them wear a mask. So in such cases, we do advise face shields, but otherwise always go for a mouth mask. And it should cover your nose. Now, it should cover from nose to mouth to your to the lower border of the lower jaw. And wet masks, preferably if you're wearing a cloth mask, wet masks are not very protective. And they should have, and you should always carry an alternative mask in your handbag, or, and they should always be kept in a separate envelope. And cloth mask should be washed every day. And when you're using a cloth mask, preferably use the one with higher fiber count. And it has to be used in public places and shared transport as well. But I do not say that you should be wearing a mask 24/7. When it is a public space, yes, maintain a mask. Mask should not be worn if children are below 2 years of age, and medically compromised patients preferably should wear N95, especially when they're exposed to the general public. Do not wear mask during the activities like swimming or running, and disposable masks should be discarded as medical waste in separate bins. Now, amongst all these masks, I think you can see one picture where we have a transparent mask. I was told that I'm addressing the nursing department, I'm addressing the speech and therapy section, I'm addressing the paramedical section and the MLT. Why did I put this clear mask is because people who are working in the speech therapy section, you will come across patients who have hearing impairment and who have hearing impairment. In such cases, I think you do know that people with hearing impairment depend on lip reading. So especially for a category of special children, or a category of children with special needs, you need to modify masks accordingly. So if you can have these clear masks with sheets of plastic maybe in between, this is only so that the lips are visible to help lip reading per se. Now coming to the general instructions, we as health workers, how should we be? when patients approach us during a COVID situation. See, this talk is about the rights, the human rights. It is not completely, it is not only about the information on COVID. It is about how you should be. As I told you at the initial phase of my talk, that it is about human rights. Everybody has a right to a good health care. So when they come to you, and this is the time when they come to you for healthcare, the approach that we should have should be very holistic. We should partly transform ourselves into psychologists. I believe we should have developed a little more patience than usual. Now we should listen to the concerns of parents, reassure patients, reassure them, keep them safe and relaxed at all times, teach them not to stigmatize another individual. That happens quite often when another patient is tested positive, or even in a even if a scenario, even if a section of your health center has one section totally dedicated to people tested positive. I do not think anybody walking into the hospital, or any other individual in the hospital, has the right to stigmatize that section. Everybody needs to cooperate, and everybody needs to be very supportive of these people, because ultimately what we see post COVID is a level of depression, a level of a different set of scenario or different exposure, because of which there is a downhill for all these patients, and also for the health workers. It is important that we give everybody age appropriate facts only. And for the purpose of spreading this awareness, I think we should use educational videos, or talk sensitize these patients and educate them. When I say patients, I think we also need to educate ourselves. So we need to keep reinforcing ourselves too as health workers. Now, what should be other things that we should keep in mind? Infrastructure at your workplace. Now, this is applicable to all the places of work. So you can advise the same to the patients who come to you. You can probably follow the same in your work sphere also. So you should have designated entry and exit points. You should have dedicated areas for thermal checks. Of course, the university per se is already following all these things. Flow markings, if possible, to containing food traffic, so that social distancing maintenance becomes easy. Avoid gathering in common areas. The whole point is, see, when I say food traffic, and when I say designated entry and exit points, I suggest these things or propose these things only in places where you can anticipate too much of crowd, and at the same time have separate isolation rooms, and take extra precautions for elderly staff, pregnant women, and ones with pre-existing medical condition. Another interesting point, that I need to add is, I was going through one article recently. It was given by WHO, and they were giving us basic guidelines. And the interesting part that I came across was that they spoke about gender equality and prevention of violence against women. See, the interesting line that I read over there is 70% of the health workers, or the people who are caring for the sick, or in homes as well as in the hospital, are women. So I think it is their right also to a good health care. So we have to keep those options also open, and we have to worry about their rights too during, since we are talking about this situation on Human Rights Day. The next slide over here, as you can see, is the dilemma of a healthcare worker during COVID-19 pandemic. This is a fantastic graph that I picked up from one of the sources that I was doing my reading on. So here they have given us 5 things: decision making, and they've spoken about care for severely unwell patients, allocation of resources, aligning patient needs with family, balancing physical and mental health needs of workers. See, what happens is, we are in this kind of dilemma. What do you do when you have an severely unwell patient? What if he is COVID positive? You as a healthcare worker, you are in a dilemma, because you cannot say no to working along with them. But at the same time, you have to worry about your family. You have to balance everything, the physical and mental health of yourself, and also the colleagues that you're working along with. You have to align with the patient needs with family, and also allocate the resources. So these are the dilemmas that the healthcare workers. So, and Why did I highlight these dilemmas? Because it is your right to feel all these things, because it comes in human rights. So it is not wrong if you feel that you also need to take necessary steps to take care of yourselves at this point. Another thing about for and what do you say? A tip for us is extended role for allied medical branches is we need to be alert, we need to be aware, and then we need to act. So we always have to be on high alert. Now, one more thing that I would like to highlight is, see, you have these patients, the patient parties coming to you. um, this is not the usual situation. This is a COVID, or it is a situation where there has been an outbreak of pandemic. So in such cases, one of the biggest battles for you, one of the biggest hurdles for you is going to be the negative impact or the changes in the patients. See, when they come to you, the patients normally, if they are found to be COVID positive, or if they are under doubt to be COVID positive, then there's a constant chance that they are constantly angry. They might be overtly sensitive. So when you're talking to them, they might not take it the way you would want them to take. Next, they want to be prioritized. They forget that even you are a healthcare worker, even you have family, in the backdrop, but they want to be prioritized all the time. Their focus is, the attention is diluted. They have no focus whatsoever. They tend to cry easily. They have exaggerated fears and phobias, and they look at every do's and don'ts that to say in the negative way. See, these things, when you're working as a healthcare worker during the COVID situation, you need to be aware of this. Why? This is to prioritize yourself, because this is your right also to take care of yourself, of your mental health. See, all these negative impacts that they come with can also affect your mental health. So again, on Human Rights Day, I do believe and I do emphasize that you should take care of yourself, and you should be aware that this is the situation that I might come across when you're facing a COVID situation. Now coming to the nursing staff, I do know that some of the attendees of this webinar are also nursing department. And we do know that nursing department is the core strength of any healthcare. So again, as I was going through a couple of articles today and yesterday, I read a few review articles, how should the role of a nurse change in response to COVID-19. One of the very interesting articles that I came across, there was another article, I don't think I've cited it over here. Nurses' sense of duty, dedication to patients' care, personal sacrifice, and professional collegiality is heightened during pandemic or an epidemic. So the concerns for personal and family safety and fear and vulnerability issues, remain paramount for these people. And most often, these nurses are willing to accept the risks in their occupation or in during this pandemic situation, which we have to appreciate. But at the same time, the significant impact of nurses' experiences will highlight the need for strategies around self-care and ongoing support to ensure that the health of the nurses is also maintained. So what is important at the end of the day is that the government also takes certain steps to ensure policies, which will definitely worry about the health of the nursing department also. So that we need to bear in mind. Next, this is general instruction again, special instructions. This is for everybody and anybody who is working in the health department, or also for the general population. We can all help each other by avoiding these accessories. I think you can avoid accessories like ties, watches during the COVID situation. I remember while going for one of my awareness talks, for the teachers, I remember having met the Vice Chancellor, then our Vice Chancellor, Dr. Satish Bhandari, and he did remind me that try to put in a point where that, the kids should not be wearing watches and ties to school, because maintenance of, disinfection becomes very, very difficult. And I believe it is a valid point, but I also believe that it is applicable to everybody per se. Anybody working in any profession during COVID situation. And we should also have health experts speak on COVID time to time, and there are videos available, and we should point out very healthy and very authentic videos and try to pass it on. not any WhatsApp information that is available, but authentic videos. And I think we are doing it already. But these health talks should be more often, and there's something called as reinforcement that should keep happening again and again. Next thing is the mental well-being, and the elevating fear on myths of COVID is very mandatory. So we need to we need to remove the myths. We need to, um, um, we should have wellness programs more often in our institute. That is the very reason. We should have a psychologist in place, because I think every one of us is going through a downhill. This whole situation is very stressful. So I think we should make these services available. But I do believe that we are the privileged ones, because we're working in the health sector, we're working in an institute. So these provisions are available for us, these privileges are available, but we have to spread the word that these privileges have to be taken advantage of by the general public also. These are some things that we have to put across to the general public. The wellness programs. See, if at all you're working in a, why are these wellness programs important? Why? Because 88% it improves the employee's health. When you have a wellness program in an institute, it reduces the healthcare cost, mainly because 70%, 77% of the organizations indicate their wellness program is somewhat or over effective in reducing the healthcare costs. So when the patient is mentally well, definitely I believe that his systemic factors become less threatening to him. Sometimes they say, we have a concept of um, how should I say, a mental well-being which actually acts upon the entire overall system of your body. And finally, 53%, the culture of health, 53% of the organizations want to create a culture that promotes health and wellness. So what are the benefits? If you're working in an institute which is giving you wellness programs, which is having more and more wellness programs, I think as an employee of that institute, you should make use of all the wellness programs that is given to you by the university. It increases the employee's morale, it reduces the employee's sick time, it improves the company's image, increases the productivity levels of a particular company or an institute you're working for. It reduces the presentism, it reduces the staff turnover. Higher commitments is what is the ultimate benefits of wellness programs. Now, how will you cope with a stressful situation such as COVID-19? These are the do's and don'ts that I came across, which was put forth by the WHO and the other sites. So one thing is, you have to understand that during a COVID situation, mainly owing to the isolation that happened during the lockdown period, it is normal for us to feel sad or stressed or scared or angry at the same time. So you need to keep talking to people, you need to have friends, you need to communicate in whatever form. You can probably turn to your elders in the family, you can probably turn to the kids in the family, but keep the lines of communication open all the time. Maintain a very healthy diet to take care of yourselves, and do not turn yourself towards something like smoking, alcohol, substance abuse of any kind, because that is definitely not going to help, because whatever pleasure you probably get is going to be very, very temporary from all these substance abuse. And whenever you're trying to gather some kind of information, make sure that the information that you're collecting is actually right and it is from the authentic source. Just do not follow anything that comes in the WhatsApp university, is the term that we normally use. Make sure that the information that you're getting from is from the right source, because that definitely helps your mental stress levels. Limit worry, where, yes, a lot of people have focused their energies towards, I think, television these days, or different sites in the form of internet. Unfortunately, I think what you need to bar yourself is, you need to limit the news that mainly concentrates on COVID per se, 24/7. Any negative aspects of COVID-19 pandemic, I think you should not focus on it that much. You have to worry more about getting well or overcoming the situation. And yes, you have to be aware, where the COVID is spreading, the numbers, yes, but I think everything needs to be on a balance. Then draw on skills if you have any hobbies, because I'm sure during COVID-19, one thing we have all realized, we have a lot of time on hand. So instead of concentrating on the negative aspects of COVID, I think we need to go back into our old habits or old how do I say, the skills that you must have used in the past that have helped you manage in your previous life's adversities. Use those skills and help you manage with your emotions during this time. So again, do's are positive thinking, regular exercise is a must, balanced diet is something you should maintain, relaxation, in any form. You can attend a lot of wellness programs, you can socialize but online, take a break from your routine work, maintain a very healthy lifestyle. So this is what I can emphasize on. The next thing is when we say social distancing. See, the first few points that I spoke about was mask, social distancing. When I say social distancing, do not distance yourself socially to the extent that you let go of all the attachments of your life. I think at the end of it, we know that once we have overcome this COVID situation, I think we all need to go back to our families or our social circles, because that is very important since we are born as human beings. Staying connected to each other or having a very balanced atmosphere of family or friends is very, very important for a mental well-being of any human being, being born. That is the basic in human body. So, for example, this is a fantastic picture that I came across by the WHO again. They said if keeping your grandparents safe, it means you can't visit them in person. Make sure that, you have talks online with them. You can go FaceTiming with them. There are different ways. Call them quite frequently, but keep them in the loop. A lot of elderly people, a lot of people are going into depression. That is what has COVID led to these days. And unfortunately for us, a lot of people, having gone into an isolation phase during the lockdown, do not want to come out of it. I have a couple of my own family members who refuse to even go to a supermarket these days, because everything is online, and they're enjoying that phase of ordering everything online. But and they want to avoid even the smallest of family get-togethers, if at all we're trying to have any. See, ultimately it is all about balance. You have to maintain a balance. You have to understand the seriousness of the condition. Yes, there is COVID-19, but you have to find a way to tackle the situation. You have to go back to what it was before, especially socially. So prolonged isolation can take a toll on the mental well-being. People have psychological issues. So I think we should extend help to all of them. All age groups get affected by it, irrespective. It can start from the geriatrics and goes down all the way to children. See, we have a lot of parents coming to teachers, when during my awareness programs, I did come across a lot of teachers who said there is constant complaint from the parents. What did they speak about? Because the children were so isolated, they did not play with their friends, they did not have social interactions with other kids of their same age, or probably in their colony, or however in their societies. Children had nightmares. Children had bedwetting, developed things like bedwetting. They had an aggression in them because the frustration was not out. They had difficulty in eating. There was increasing clingy nature. And I don't know, and children also have a problem going back to school now. I'm sure they have enjoyed this honeymoon period to such an extent that I think they will give a lot of resistance to going back to school. So these are the things as a healthcare worker you should be aware of. See, when you're going to face a patient, it's not going to be only a geriatric patient or a patient who is going to be ailing from certain thing. I think COVID situation has brought us to a point where when the patient comes, he comes with a baggage of psychological issues to you. He comes with a baggage of frustrations to you, and you should be you should gear up, to face that too. And so these are the signs that this is the way that you can recognize these signs in these patients. These patients also refuse to maintain personal hygiene, which is a sign of mental depression. They can't regulate their behavior or emotions. People start fighting. I'm sure even when you're working in your OPs or in the outpatient departments, you must have come across very irritable patients. You have to understand the COVID situation has led to financial stress, economic instability. A lot of things are playing on people's minds. Everything about their future seems unsure or unstable to them, and which probably they're showing it over here. And faulty eating habits, unhealthy or binging habits is something that has come into your attention. Another section that I want you all to give attention to is also going to be special children. See, within some time, this group is also going to come to the healthcare center, for treatments. They were out of treatment for, they have discontinued their therapies for a very long time, almost 8 to 9 months. All these children and, children with special healthcare needs, require therapies. It can be speech therapy, it can be physical therapy, it can be different kinds, audiology. There are so many kinds of therapies that they were on, and which maintained a good lifestyle for them. But everything has been discontinued, mainly owing to the COVID situation. So discontinuity in some essential developmental services like occupational health services, behavior and speech therapy. So what will happen is there will be a continuity in adolescence, a development of athletic and vocational skills. So all this will have an impact on these children. So parents may avoid seeking. So what has happened is even the parents of these children have avoided seeking healthcare services, mainly to keep these children safe. So ultimately, even these people are going to come to you, with a sudden bang. And when they come to you, I think you have to be mentally well prepared to face this situation as well. Now, how should you maintain your own general well-being, and how should you ask others to maintain their well-being? One, exposure to sunlight during COVID situation. That could be low. So, India is a country with a lot of home remedies. That is our plus points. We talk about kashayas, we talk about tulsi decoction, we talk about turmeric milk, all your grandma's therapies. I think we should make use of all of these. Warm water, steam inhalation with turmeric, salt water gargling. I think this should become, your routine, at least for the present situation. You should avoid frequent snacking also. What are the dietary recommendations that I would advise? This is for you as well as your patients or whomever you come across with. One is increase vegetable intake, be it cucumber, pumpkins, ridge gourd, bottle gourd, yellow cucumber. You can increase the consumption of vitamin C in a day. You can have a lot of citrus fruits at least once a day. You can have you can have a sweet lime, you can have an orange, or you can have amla at least once a day. Instead of going into tablets, I think this is more natural. You can increase your consumption of turmeric, ginger, garlic, and cinnamon in your system. These are all which will increase the immunity in your system. And the dietary recommendations that I'm talking about, the slide that I've put, actually comes from the diet department of Shema. So when I did my training programs, I did ask them to give me a few points on what I should advise the teachers or the patient parties to follow. So this was given by them. You can reduce what they told me was we need to reduce carbohydrates during COVID situations. We need to we should not have root vegetables, especially potato and sweet potato. We can reduce the consumption, probably the frequency of consumption. You can avoid peas, you can avoid cauliflower, capsicum, brinjal, because brinjal apparently brings in a histamine release, which in turn leads to inflammatory reactions. Food high in salt and sugar should be avoided, and avoid soft drinks, sodas and cakes, etc. Now, finally, the dietary recommendations. If you are a patient who is recovering from COVID, these are the things that you can advise your patients also. If you're a vegetarian, you can go for sprouted green gram, which increases the protein intake. And you can go for options like soya, ragi in the form of dosa, idli, porridge, whatever is fine with you. You can go ahead with that. And if you're a non-vegetarian, you can increase your intake on fish, you can increase your intake on eggs, and you can have chicken at least twice a week. I think you can avoid red meat as much as possible during COVID situation. If you're a diabetic, you can consume all sorts of fruit. For general people, any fruit is okay. But for diabetic, we advise only papayas, pear, and apples. Now, again, since we are in the health sector, transport is something that we take, we commute every day to our work. So what are the things that we need to follow? One is mandatory thermal screening. Try to avoid public transport, but I cannot be saying try to avoid public transport all the time, because we are coming to some amount of normalcy. I would say, if you're planning to take a public transport, just maintain the basic rules: thermal screening, hand sanitization, and of course, social distancing and mask. Now, assign seat. If it is a public transport that is provided to you by the institute, I think you can have permitted seatings. You can sit in the same seat if possible every single day, so that in case tomorrow you become COVID positive by any chance, you do not at least spread it to another person. That is your responsibility. I think that was one more thing that was told by the human rights. We all need to work in solidarity. We have to be responsible for ourselves, and we need to be responsible for others too. And minimum avoid the number of people in the buses as well. We have to take care of our essential service providers, especially our housekeeping staff. We have to provide them with PPE kits. I think the awareness programs that we have for ourselves or any other sector of the health department, I think it is mandatory. I think at we should try to make it mandatory for housekeeping staff and the drivers and the volunteers who work for us. I think it is their right to have information on COVID. I think we should have more programs for them as well. And we should invest on all these post-COVID requirements. Of course, being a health institute, we do invest on all this. But this is an awareness that you can probably spread to the general public also, who come to you. Cleaning and disinfection of the workplace has to be a regular thing which you need to maintain, especially 1% sodium hypochlorite. And ultimately, after all these precautions, how can COVID-19 precautions fail? Mainly because if you have failed to maintain physical distance, see, I do say that everything has to be a balance. You need to maintain social contact. You need to come back to your normalcy. But probably, when you're going back to your social circle, see to it that for some time maintain your physical distance from your friends and family and well-wishers. You should not respecting social distancing during a family function or any public gathering, is very irresponsible of you. And for a social gathering or entertainment, always try to go to an outdoor or a very, very well ventilated area. These are the small pointers that I think you should keep in mind. And finally, social events like weddings, parties, outing, visiting eateries has to be done with utmost care. Of course, these are things that you cannot avoid. So especially when things are coming back to normalcy. So I think these are the basic steps that you need to follow. Ultimately, this is you have to be aware of your service providers too. So this is Dakshina Kannada helpline number. Of course, you're very lucky or privileged to be working in a health institute where you have people taking care of you. But this is the number probably we are giving to people, if you're bringing in, you're giving out the awareness to the general public. And finally, my credits to Dr. Vikram Shetty, who helped me a lot with my presentations or my information on whatever I've put into my slides. He's from the Department of Orthopedics and a member, who's been an active member of the COVID task force. And then Dr. Kavita Rai, who's a professor in the Department of Pediatric and Preventive Dentistry of AB Shetty. For all my sources from the WHO and the Ministry of Home Affairs, Government of India. Ultimately, I hope I have done justice to, whatever topic I've given. So I think keeping human rights, keeping this day in mind, I think we need to recover better. We need to make this world a safer place. And this is our opportunity to change our lifestyle or probably start afresh. So with this message and with this takeaway message, I think I will come to the end of my talk. Thank you and stay safe.
Thank you very much, madam, for enlightening us with valuable information about COVID-19 pandemic. Now, I call Mr. Dinesh Kumar Shetty, lecturer, Department of Humanities and member of Electoral Literacy Club, for word of thanks. Over to you, sir.
So now we come to the last stage of the program, but equally important. On behalf of Humanities Department, NITE deemed to be University, I thank Professor Dr. Satish Kumar Bandari, Vice Chancellor, NITE deemed to be University, for his valuable support. Thank you, sir. I thank Professor Dr. Alka Kulkarni, Registrar, NITE deemed to be University, and Professor Dr. M.S. Muditaya, Pro-Chancellor, NITE deemed to be University. And I sincerely thank Dr. Amarashish Shetty, the resource person, for enlightening us. Thank you, ma'am, for your elaborate speech on COVID-19. Special thanks to Dr. Sadhana Deshmukh and Supriya from the Staff Development Center. I thank Dean K. Segade Medical Academy and Dean A.P. Shetty Institute of Dental Science. Thanks to IT department, We thank principal, teaching and non-teaching staff, students of NITTE Speech and Hearing College, MLT, IT, OT and RT. NITTE Usha Institute of Nursing Science for their active participation. Thanks to Dr. Saigita and Dr. Bhagyashri Bandari from the Humanities Department for their guidance. Thanks to the office bearers and members of NITTE Electoral Literacy Club. I thank all audience for patience hearing, and I also thank to the program coordinator, Mrs. Suma NS, for organizing this program. So thanks to one and all. Have a nice day. Thank you.